Again, as soon as you see this slide, you will jump in joy because this is the slide of compact bone. But where you can go wrong is in identifying this section. In your excitement, if you mention this as transverse section, remember you will lose the marks. This is the longitudinal section of compact bone and again a ground section. In our previous discussion, we discussed about the structure of transverse section of the compact bone. Here we have the longitudinal section. Here we cannot identify the periosteum. Now, if you are asked to describe the structure of this section in particular, this is how you should describe it. This is possibly the longitudinal section of a compact bone because we can see the longitudinal section or the entire extent of Haversian canal in the center of the Haversian system. And these Haversian canal seems to be connected by the Volkmann canals, and individual Haversian systems are seen to be separated by the interstitial lamellae. What is not seen here is the periosteum because this is the longitudinal section and the outer circumferential lamellae and inner circumferential lamellae. This is how you should describe the identification points to the examiner. And then if the examiner asks you to describe the structure, you should describe it in a similar way to the transverse section of compact bone. That is, the compact bone consists of an outermost layer called as periosteum, which is divided into outer fibrous and inner cellular layer. The inner cellular layer, which contains osteoprogenitor cells and osteoblasts, is connected to the outer circumferential lamellae by Sharpey's fibers. Similar to periosteum, the medullary cavity is lined by endosteum. Then, when we come to lamellae, which are calcified matrix, this is organized in the formation of outer circumferential lamellae, inner circumferential lamellae and the Haversian system. In between the Haversian system, we have interstitial lamellae. Haversian system consists of a central canal called as Haversian canal, which allows for the passage of blood vessels and nerves. Individual lamellae are separated by small spaces called as lacunae, which will contain osteocytes. Individual lacunae across lamellae are connected by small units or extensions called as canaliculi, through which individual osteocytes communicate. Interstitial lamellae, which lie in between two Haversian systems, represents degenerated Haversian systems which are produced during remodeling. Individual Haversian systems are separated by cement line. And if the examiner asks or probes further, start describing the bone cells, composition of the extracellular matrix. But in general, the histology of compact bone should be described in this manner. Thank you.